My name is Dr. Sanjeev Sriram, and I am a member of Doctors for America. I am a pediatrician in Southeast DC, in the backyard of Congress. We identify mass shootings by hashtags and geography, but doctors know the public health crisis of gun violence is hurting every community in between those tragedies too. Every year, between Newtown, Connecticut and San Bernardino, California, 20,000 Americans commit suicide with a gun. Every month, between Aurora, Colorado and Orlando, Florida, over 50 women are shot and killed by domestic abusers. Every day, between Oak Creek, Wisconsin and Tucson, Arizona, 90 American lives are taken by gun violence. These are our mothers, fathers, brothers, sisters, grandparents, friends, classmates, and they are my patients. My patients and their families in Southeast DC are struggling with gun violence, while many in Congress are turning a blind eye, a deaf ear, and a cold heart to this public health crisis. Many parents are asking, what are we going to do about all this? Right now, more than 10,000 children are shot and killed each year by homicides, suicides, and unintentional shootings. That's more than heart defects, cancer, and infections. Children are also injured or killed in car crashes. But you know what's interesting? When any of us from the medical or public health communities talk about keeping people safe with seatbelts, car seats, speed limits, we get to have a civil, grown-up conversation with car manufacturers, transportation agencies, law enforcement, and the CDC. No one is calling us doctors communists or questioning our patriotism or threatening to take our medical licenses away. Gun lobbyists have been bullying doctors and public health professionals for a long time. Since 1996, gun lobbyists like the NRA and their friends in Congress have used the Dickey Amendment to intimidate the CDC from studying gun violence. Some of our best and brightest minds are using science and research to save millions of lives from car accidents, smoking, drowning. Those same scientific methods can help end gun violence. 20 years of ignoring questions that public health and medical experts want to solve in order to help save thousands of Americans from gun violence. 20 years. 20 years of unanswered questions. Since 1996, we've learned the answers to all kinds of other questions. Will Ross and Rachel make it as a couple on Friends? Will Tom Cruise keep doing Mission Impossible movies? Are there worse songs than the Macarena? Yeah, thank you, yes. All joking aside, there are more important questions we should have worked on in the last 20 years. Here are some of the questions public health experts want to work on in gun violence. They want to know what kinds of programs and supports help families and communities stop gun violence among young people. How does gun storage, how does the way a gun is stored affect the decision to use that gun in a suicide attempt? What characteristics differentiate mass shootings that were prevented from those that were carried out? Now imagine if the CDC and NIH had funding to answer all those questions. That's why we need Congress to end the ban and properly fund gun violence research. I'm not the only doctor who knows this. Over 140 medical groups, including Doctors for America, the American Medical Association, the American Academy of Pediatrics, the American Medical Student Association, and many others are demanding Congress to support gun violence research at the CDC and NIH. Let's end the ban and end gun violence. Medical and public health personnel need you, our fellow Americans, to be part of the changes in policy and culture that will end gun violence. We can stop another American town from becoming a mass shooting hashtag. We can guide families with mental illness or domestic violence towards recovery instead of tragedy. Ending the ban on CDC gun violence research and letting doctors ask about guns are the steps that we can take together on a very long, very difficult journey to end gun violence. The time to start is now. Thank you.
Ladies and gentlemen, please welcome to the stage Faith Grant.